Hi, I'm Dr. Leila, a California board certified family and cosmetic dentist and the proud owner of Leila Hariri Clinic in Dubai. I graduated from UCSF, one of the top 5 dental schools in the world, and bring over 25 years of experience, 21 of them right here in Dubai. I've been honored with the I Love My Dentist Award twice, thanks to the trust and connection I share with my patients. My mission is to transform smiles, build lasting relationships, and make dental care something you can feel confident about. Join me as I share expert advice, stories, and insights to help you achieve the healthy, beautiful smile you deserve. Welcome back, everybody. And today we have our lovely hygienist Yasmeen back on the show. Did you know that some of the most dangerous oral health issues show no symptoms until it's too late?
Absolutely. Cavities, gum disease, even oral cancer. Unfortunately, whenever we see the signs, it is already too late.
Let's start with one of the biggest misconceptions. If your teeth don't hurt, they must be healthy. Is that correct?
Of course not. And I think this is one of the biggest excuses people use not to go visit the dentist regularly. The idea is that with the starter of cavities, even if it's enamel, it's something that we can prevent, and no pain is going to result from that. And once it goes deeper and deeper into the tooth layers, that's when some pain starts, and then we have to drill and fill. To avoid all of that, we emphasize on doing those routine checkups to make sure that we are following the right oral hygiene routine at home and at the same time catching any disease on its early signs.
Absolutely. And this is where I tell my patients, lovely Yasmeen, that I get gray hair because every day I'm like a broken record. I see these cavities, but they're like, "Doctor, I have no pain." Well, exactly. At this level, you don't have pain. But if it goes unnoticed and you don't do something about it between the hygiene we give you in our clinic and at home, definitely it's going to grow. That's an absolute. So therefore, we need to inform you. You need to take charge at home and so we can get the right balance. This is crucial. But I get this every day as well as you, but I don't have pain. Now, for your field, it's more gums. What can you tell us about the gums?
Yes. So one of the biggest controversy that people think that because my gums are sensitive, that's why they're bleeding. And I always tell them I'm very sensitive to words. So let's not use the word sensitive for gums. When your gums are bleeding, they are unhealthy. There is an inflammation. And one of the early signs of inflammation or gum inflammation is actually seeing a little bit of redness, maybe feeling a little bit of irritation. Once you see the bleeding, know that it is already an advanced level of gum inflammation. And unfortunately, this is when we have to intervene. But if you do your routine checkups again, you basically notice the areas where you are not flossing properly or not brushing properly, and then you can catch it early on and not go into this nitty-gritty area where people start saying phrases like, I hate going to the dentist because we
Correct.
are inducing pain.
Correct.
So
It
it's
is
all
very
about,
painful.
yes, it's all about just early checkups, making sure that we are, again, adjusting that routine to what is effective to each person individually.
Absolutely. So again, I tell people all the time, if you do your job at home and don't miss your 6 months routine checkups and cleanings, you can almost sleep through it. I don't want to say it for everybody because some people are just more in tune to their bodies and they're more sensitive, but really it shouldn't nothing actually. Even what is the worst thing we think about when we think about dentistry? Root canals, extractions. None of it should really be painful, if done by the correct person in the right way. It's I'm not saying it's like smooth ride, but it shouldn't be painful. So we got to get that out of our head and know how prevention can help all of this. As we've always said, prevention.
Prevention is
Absolutely.
key. Yeah.
Prevention is key.
And when you say like sleep through it during the dental visit, I think that's the hugest compliment for both sides. That you as a person, you're doing your job in the right way at home, and that we were able in the clinic to provide the right message. So it means less work for us and less discomfort for you in the dental chair.
Absolutely. Correct.
And another important thing is that we need to learn to emphasize on the point that it is customized. So yes, 6 months is the routine thing for the checkup. But whenever you have someone with a medical issue, let's say diabetic patients, patients who have cardiac issue, blood pressure, there's an importance to individualize those visits, make it more understandable that it is connected to your general health. So maybe every 3 months is more convenient, or every 4 months. So customization of these visits is key also to make us
Very
less
important
of
note.
a.
And on that note, a lot of times when you see bleeding, for example, and now more and more as a clinic, as a team, we're going towards biological dentistry and holistic health. What we see in the mouth is related to our entire body. So, for example, there's two conditions, depression and diabetes. What are the signs you see, lovely Yasmeen, that you can actually pass on that information to your patients to look out for these?
Lovely topic. Honestly, I will never get bored of hearing the word holistic. I know it's been used a lot nowadays, and we use it in the clinic a lot as well. But the whole idea is to understand you don't walk into the clinic seeing a head on the on the chair. It's a whole body, it's a whole person. So thinking about diabetes, for example, making sure that you control your blood sugar is definitely key to reduce any gum inflammation or any infections in the mouth in general. With people who are not controlling their blood pressure, either through medication or through their diet, you notice a lot of complications in the mouth, starting from uncontrolled gingivitis, uncontrolled gum disease. You notice signs of infection, of fungal infection, and we can go on and on. And it's definitely key to understand that connection and understand that people are open to this level of awareness. We are ready to spread that level of awareness, that you understand your disease, maybe be friends with it, and learn how to manage throughout. Depression is another topic. Whenever we recognize that the person sitting on the chair has depression and they are brave enough to actually share that information, there's a two-way road here. One of it is noticing what kind of medication they're taking, because most of the medication for depression has the side effect of dry mouth. And that usually is a huge burden if not treated in the proper way. It compromises the quality of life and maybe even makes the condition more worse. So that's one thing. Another thing, for the sake of time, not to dive into too much information in the side effects of depression medication. Another thing is to tell that person to take it easy on themselves. On some days, they might find it a little bit difficult to brush or to floss or to follow even the simplest routine. So the whole idea is to understand how can we motivate them in the right way and have them understand that it's okay. It's a roller coaster ride, even when it comes to your oral health. And with time, we start improving that daily routine.
Correct. And as I've heard you always mention, is that with both depression and diabetes, it's a two-way street. One affects the other as well as the other way around. For example, having diabetes increases your chance for, having gum issues, and gum issues does increase your chance for having diabetes.
Absolutely. It makes it more difficult to control those blood sugar levels. There are indicators that whenever you have gum inflammation, a certain enzyme in the body starts increasing also your blood sugar level. So again, a two-way street for sure.
It's a two-way street. And it's a vicious cycle.
Oh, yes.
So poor oral health can contribute to low self-esteem, chronic pain, and even more mental distress.
Absolutely.
And we see this, actually. We see this on our daily work. So anyways, that's why I really believe that oral care should be integrated into your wellness routine, if I can say, because more and more we're hearing about wellness, and your oral care really should be integrated in that. I think you definitely agree with this.
It's a big deal having that healthy, beautiful smile. It's not about just having white teeth anymore. It goes even beyond that. And I think we are very lucky to be practicing at a time and age where this is actually something you can motivate. I mean, you've created a video recently to talk about that a dentist is not just someone who, puts in fillings. They actually change lives.
Very true. Absolutely. And something that I want the audience to know is plaque and bacteria can hide in places where it's not visible to you. So you might say, I'm looking at my teeth and they seem clean. and I'm sure you've heard this. What can you tell us more on this topic?
I love the phrase they hide in places you don't expect. Like, for example, the tongue holds 75% of the bacteria. And I have to confess, I'm one of those people who's guilty of forgetting to remind about brushing your tongue. It's very important to brush the tongue. Another thing, an amazing tool that has been there for ages, and we need to learn to use it not just in the clinic, but also at home, is the disclosing agent. I just love having that guide where it shows you exactly where you are maybe brushing too fast or not brushing at all. Why is cleaning in between? I know we keep saying flossing, but there are other aids. But why is cleaning between the teeth so important? It's where those tiny bacteria hide, and with time starts causing trouble.
And in your hygiene protocol, I know you use this disclosing agent. Can you just give us a quick brief? I know you've done a video about this on your steps and why you do it in those steps.
Oh, no, I've learned to fall in love with the disclosing agent, but I have to give credit to the EMS GBT system, which is short for guided biofilm therapy. So basically, what you do, you start by showing exactly where the areas that have been neglected for so long. And with the new technology of the double shade disclosing agent, you can see the bacteria that's been there for an hour or so, since you brushed in the morning maybe. And the darker shade is where the bacteria that you have been neglecting for over 24 hours. And this is a roadmap, not just for me while cleaning, but also for the patient to give a little bit of extra trust, especially if they're seeing me for the first time and they are like convinced that they're doing a great job at home. But seeing that evidence definitely is like a wake-up call. Like, yeah, maybe I'm not brushing because I'm right-handed. I'm not brushing, the right side properly. And maybe I need to give it a little bit of attention.
Correct.
Maybe this is just an example out of my head, like the water floss is not doing exactly what it should be. Maybe I need to also use an interdental brush in that space. So that's usually the first guide, is to diagnose and to motivate the change in the daily routine.
Beautiful.
And of course, everything that comes after that, we customize it depending on the patient's needs. So if there's calculus, we're cleaning the calculus. If there's just soft plaque, we're cleaning it and celebrating because it's going to be a light visit. And never forget to recheck and protect. So recheck, I don't think we can ever get rid of our manual instruments. We love them too much.
Yes.
They give us a lot of
And I think patients
precision.
are so used to that feel because that's how hygiene started, that scraping feel. But now we know for sure we're not harming.
Absolutely.
If we ever did, I'm saying.
Absolutely. Even the new studies, they tell us like the more you focus on reducing the plaque in the beginning with the new technologies of airflow and even polishing before starting with the rubber cup and the paste.
So that's why, you start with the airflow.
Definitely. I mean, I'm very thankful for this technology and very thankful for the new powders that have been produced, because it means that you're not leaving scratches on the teeth.
Because they're very fine.
Exactly. That nanotechnology. People used to think that every time I do the cleaning, you are removing part of the tooth. And the same controversy with whitening as well.
Yes.
And it's very important, I think, for us to explain what we're doing, so people have this awareness that no, when you come to the dental clinic, our goal is not to scrape off your teeth. We're just removing the harmful biofilm that you cannot remove at home anymore. And then by changing your daily routine again, you might have less and less of this harmful biofilm, and you will sit less on our chair eventually.
Absolutely.
The ultimate goal.
The ultimate goal. And yesterday I heard while I was doing my exam in your room, you mentioned to the patient, you might hear us give different feedback to you, or not feedback, but protocols perhaps, and that's okay. Could you elaborate on this?
Oh, yes. I mean, we're one team, whether we are in the same clinic or, people coming from different clinics. It's very difficult to ask all clinicians to give the same instructions because they come from two places: scientific evidence and from your personal experience. And I'll put myself out there. Like, I am not a huge fan of the water floss, but I learned from people who recommend it to actually try it over and over again to understand what is that feeling it provides. And then with the scientific evidence that tells us what is the best interdental cleaning tool, we add that to the equation. And we also add the results that we see. This is something I've learned from the iTOP workshop. By becoming an instructor, you learn that there are 3 criteria you need to follow with any instructions you give in the clinic. Number 1, acceptable. Not for me as a clinician, no, for the person who's going to apply the instructions. The second thing, that it should be an effective tool, meaning that it is reducing that biofilm from wherever you need to use it, and that it's effective on a daily basis. Number 3, which is very important, that it's atraumatic. It's not going to cause any gum issues. It's not going to cause a recession, for example, or those black triangles. It is not going to cause any abrasion on the tooth surface. And it's not going to cause any issues in the mouth in general. So if you have those 3 criteria, effective, atraumatic, acceptable, then it's okay. Let's have different instructions and let's have the patients choose from themselves. They choose what works for them on a daily basis, maybe even play around a little bit with it.
I love
Why
it.
do the same thing every day if you're a person who likes change? Like for 1 week, do a daily floss. The second week, do interdental brushes. I cannot say do water floss alone. I'm trying. But again, if it works for you, if we
Correct.
see that there are good results, no more bleeding, no more calculus, then thumbs up to that.
So effective, atraumatic, and acceptable.
Yes.
You'll be hearing us say these 3 words to you when you come, and it should be ingrained in us. It's beautiful.
We'll create a song even for it someday.
Oh, that would
Yes.
be amazing. We
Yeah.
should. Thank you, lovely Yasmeen. And if you guys enjoyed any part of this and found it helpful, please share this with your loved ones. And if I may ask you to subscribe to us, because by doing so, it gives us more passion to bring out the best dental information on a weekly basis where you guys will definitely find it helpful. Until next time, stay safe. Bye bye.